Hello, my YouTubers, and welcome back to Jackie R Living Life Abroad. Hope you're having a great day. I appreciate each and every one of you. There were hundreds of responses to my last video, and I thank you very much to my returning subscribers and my new subscribers. One of the questions that I received was, what type of insurance do I have? Do I have travel insurance, or do I have international health insurance living abroad? And so I'm going to be addressing the difference in those two in this video. And also for my retirees and those who are maybe close to retirement, Medicare Open Enrollment is coming up real soon. I've got some tips included in this video just for you so that you can make some informed decisions as you make plans to move abroad. Okay, so let's get started. So what is travel insurance? Simply put, travel insurance is for short travel, like vacation, a business trip, or if you plan on being in the country for a short period of time, 2 months, 3 months, then you can get travel insurance. And what does travel insurance cover? Travel insurance usually covers trip cancellations and delays, which in today's world at the airport there's always some type of delay, and so you want to be covered for that. Lost luggage, emergency evacuation. Travel insurance will evacuate you in the case of an emergency and take you back to the country that you take you back to your home country. So if that's the United States, they will evacuate you to the United States. Also, it provides short-term emergency medical care. But here's the key. Travel insurance is temporary. It's for short stays, vacations, business trips, or you just plan on being in a country for a couple of months. It's not for day-to-day health needs. That's what health insurance abroad is. So what is health insurance abroad? Health insurance, unlike travel insurance, is for day-to-day activities, day-to-day living. So your health insurance abroad, when you purchase your health insurance, it will cover doctor's visits, specialist care, hospital stays, prescriptions, and preventative checkups. In countries like Mexico, healthcare is so affordable that you may not need to purchase a health insurance policy. For example, a doctor's office visit, I had to go to the OBGYN for a checkup. That office visit cost me $35. So an office visit could cost you anywhere from $25 to $40 here in Mexico, compared to hundreds of dollars in the United States. And not only that, waiting for an appointment. I got an appointment like right away. Okay, and prescriptions are far less expensive here in Mexico as well. I talked about in a previous video how that when I was in Atlanta, my doctor prescribed some blood pressure medicine. A 1 month supply was going to cost me $413 at the CVS store. And I was like, oh no, I don't think so. I'm just going to wait till I get back to Mexico, which I did. And that same prescription cost me $5. That's right, $5. So I weighed the cost of keeping my Medicare Part D, which is the prescription drug plan. I dropped it before I moved abroad because I figured I didn't need it, right? So my own personal setup in terms of what I chose after extensive research is that I kept Medicare Part B. A is automatic, but I kept Part B. I dropped D and I dropped G, which was my Medigap plan. So when I was in the United States having B, D, and G, I was paying almost $400 a month for health insurance. And so, having done extensive research about moving abroad and what type of health insurance I wanted, I knew that I was going to drop G, the Medigap, drop D, the prescription drugs, and just keep B. Because here in Mexico, out-of-pocket expenses are really, really much less than what you would pay in the United States, and it's manageable. Okay, so between affording to go to the doctor and prescription drugs, it was more cost effective for me to just keep my Medicare Part B when I'm back in the United States, because then I know I'm covered, and also just use the local healthcare system. All right. So now that takes me to something that's really important that's coming up in October, and that's the Medicare Open Enrollment. So I want you to plan ahead, because this is something that maybe retirees don't take into consideration when they're planning to move abroad. So if you are planning to leave in the January of 2026, or maybe before the end of the year, now is the time to consider about what type of Medicare insurance you want to be covered with. Do you keep Medicare Part B for peace of mind, like I did, in case you have to return to the United States? Do you plan to rely mostly on the local health care system, like I did, because it was more cost effective to pay $25 to go to the doctor, $40 at the most, and pay $5 for a prescription? And I combine those two. Keep Medicare Part B and just pay out of pocket here in Merida, Mexico. Here are some key considerations for retirees. Some things you need to keep in mind as you're making your plans to move abroad. Consider your length of stay. Where are you going? And how long are you going to be there? Not only that, how is your health? One of the things that I did before I left was I made sure that I had my whole body checked. I went to all the doctors that I needed to go to and had my exams done, so that if I needed something taken care of before I left, I would know what it was, how much it was going to cost me, and take care of it before I left the United States. So consider your length of term of where you're going to be. Remember, short trip travel insurance, long term health insurance abroad, U.S. coverage. If you plan to go back to the United States for treatment, Medicare Part B is absolutely necessary and worth keeping. Host country costs. In Mexico and many other countries, paying out of pocket is less expensive than having health insurance. It's very affordable. Peace of mind. Sometimes it's not just about cost, it's about knowing that you are covered. Here are my closing thoughts and my call to actions. Remember, travel insurance, short-term emergencies, vacations, business trips, a short stay in a country, 2 to 3 months, and Medicare Open Enrollment, the perfect time for you to consider, since you're making plans to move abroad. Which plan do you keep? Do you keep B? Do you keep D? Do you have G? For me, keeping Medicare Part B was the best thing that I could have done. I had done extensive research, and I knew when I got ready to leave the United States that I was going to keep B, giving me peace of mind, knowing that if I got sick somewhere, I could take a short flight back to the United States and use my Medicare Part B health insurance. Okay. So I want to thank the subscriber that asked this question, and I hope that this video answers it, and it gives you all some insight on the difference between travel insurance and health insurance abroad, and the fact that open enrollment for Medicare starts in a few months. And so these are things that you want to consider. So if you like this video, if you got some information out of it, go ahead and click the like button and share it with others who need this information. Jackie R Life Abroad, that's the handle. All right. And let me know in the comments, are you going to keep your Medicare Part B? What plans are you making in terms of your health insurance as you travel abroad? So until next time, stay safe, stay healthy, stay curious, and I'll see you in the next video. Peace out.